Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello again, everybody, and welcome to another edition of Doc Talk with Monument Health. Joining me today is Dr. Loren Jones, an ear, nose, and throat doctor from Spearfish, from Monument Health and Spearfish, and Jeanette Carlson, the CNP from Spearfish, along as well. Welcome. Thank you both for joining me again.
Thank you.
Thanks for having us.
I'm excited for this one about allergies because I have so many questions and you guys don't have near enough time to sit here through the whole thing. But Jeanette, I'm going to try to phrase this the best way I can. I was talking with a guy earlier about this. Why? I don't understand allergies. They're stupid. Okay. And I just don't understand what evolutionary benefit our bodies decided that, you know, if you're going to eat a peanut, nope, not going to let you do that. I'm going to blow you up. You know, things that your body might actually need, you can become allergic to. Why? That's a big question, I know, but why?
So, and that is a good question, and why? I can't tell you why that happens.
Sure.
You know, there's some genetic predisposition to allergies. But basically, allergies is when your body is, an allergen is introduced to your body, and your body develops this overreactive response to the allergy for whatever reason it does. It's a whole cascade of pathophysiology that will take way too long to discuss
Sure.
in one little visit. But basically, you have this allergen that's presented to your body, and your body sends out a cascade of things to try to combat that. And then you develop symptoms, and they're obnoxious and annoying. And
it can be almost anything, can it? I mean, people
can.
can be almost allergic to. It's crazy that this is a thing our bodies do.
Yeah. So, I mean, people can be allergic to pollens, you know, trees, grasses, weeds, cats, dogs, you know, horse dander, cow dander, all sorts of foods, molds, like you name it. And there's probably an allergy for it.
So what types of allergies can a patient have? That's a big question, too, because it's... Or is there like an order of types they can have? Do you guys have it separated out into different things?
I mean, yeah. So there's definitely different categories of allergens. You can have your environmental allergens, which are like your cat dander, your dog dander, your molds. Basically things that are like kind of in your everyday environment. And then you have your seasonal allergies, which are your pollens, your grass, your trees, your weeds, and such of that nature. And then you have your food allergens too. So there are definitely different categories of allergens.
Are there people that never have allergies? That can go their entire life and not be affected by any?
Yeah.
Dr.
Yep.
Jones waving up there like,
Yeah.
it's me, totally me. There's what's called allergic rhinitis.
Yes.
Okay. What is that?
So allergic rhinitis, and this is kind of a bigger part of my practice and my piece of, you know, the clinic in Spearfish is allergies. So allergic rhinitis is when you inhale one of those allergens and it affects your nose and affects your throat and causes runny nose and sneezing and watering itchy eyes. Lots of other things can happen as well, but that's basically what allergic rhinitis is runny nose that's caused by allergies.
So can that get serious to a point where, is it similar to, you know, having somebody have to carry like an EpiPen with him because of allergies, sort of a deal? Is that
typically not with like nasal allergies,
Sure.
And your pollen allergies and your environmental allergies. I mean, food things, yes.
Okay.
Food things definitely. But as far as allergic rhinitis goes, that's more of a quality of life type of a thing.
Can you have? Speaking of that, that's an interesting question. Can food allergies are they like the most serious of allergies, maybe?
If you have anaphylactic reaction, which
Okay.
is shock, essentially,
Right.
Yes. That's
Can pollens and seasonal stuff like that do that, though? Or is that
typically
very
not.
uncommon?
That's pretty uncommon.
Okay. So what do you do then for rhinitis? I mean, obviously the over-the-counter stuff.
Yeah.
Thousands of things.
Yeah. So, you know, 50 million people have allergic rhinitis, and the business of allergy is $3 to $5 billion a year.
Oh my God.
So it's certainly reasonable for people. You know, I've got runny nose and sneezing, like it's fine for you to start some antihistamines and give it a shot. It's fine for you to start some nasal steroids and see if that helps. But at the point where it's affecting your quality of life, that's where you should come in and see somebody and do something further about that.
Do you foresee a time when we'll be able to figure this out to where, well, because you can get allergy shots,
Yes,
correct,
you
that
can.
help?
Yes.
And do those make a big difference too? Do you recommend stuff like that?
So I think the first thing we need to do is differentiate between like a steroid shot. There are a lot of people who go in and get a long-term steroid shot from their physician.
And they'll call it an allergy shot.
And they'll call it an allergy shot, and that's not a true allergy shot.
Right.
I mean, it helps your symptoms on a long-term basis, but that does come with side effects too that are not always great. But true allergy shots or immunotherapy is what we consider allergy shots, and that's injecting a small amount of those allergens into your body weekly to help your immune system kind of rethink how it reacts to those allergens.
So it can be like, I mean, so it's similar to a flu shot or similar to something like that where you're injecting a little bit of it to tell your body, watch for this because this is going to make you miserable.
So it's trying to modify your immune system so it's not reacting. And it's, the patients who, what we call buildup in allergy shots, they come in and see me weekly. They get their small dosage of their allergens, building up the concentration until we get them up to what's called maintenance dose. Once we get them to maintenance dose, we can spread those shots out a little bit and keep them on maintenance therapy, hopefully for 3 to 5 years. And the goal is to decrease their symptoms. It's not a cure-all. Nothing is a cure-all for allergies. It's a chronic disease.
That's terrible.
But hopefully, as we get wiser, meaning older in age, to be nice,
Sure.
your immune system starts functioning differently and starts worrying more about infection and less about allergies. So it is something that hopefully as we age, it does get better.
Right. So is there, if you have allergies, say when you're younger, can you grow out of them?
Yeah.
Can you have them be like someday you wake up and look, I can pet a cat, and this is great.
And I would say that's probably like more food allergies that people tend to grow out of. Kind of in that as a kid you're allergic to milk, and then as an adult you can drink it and not have issues. I think like environmental allergies, seasonal allergies, the more you're exposed, typically the more symptomatic you get to it.
Okay.
So does that make sense?
Yeah, sort of. I'll sit with that one for a minute, but yes, it does. I think mostly. So do you ever see a time when something will come around to where you're like, here it is, one shot, you'll never have to worry about this again? Or do our bodies just not work that way? Is that
Probably not.
right?
Yeah.
I think the immune system is an extremely complex and effective device. I mean, if you ever hear of somebody that has like a really deficient immune system, it's a horrible handicap. Your immune system is doing a lot for you. And Jeanette just alluded to the general idea we think of the immune system kind of targeting more toward infection, which is sort of generally what we want it to do. Or in some cases, patients with allergies, it kind of gets a little off kilter and makes a maladaptive response to normal stuff.
Right.
That's not really bad for you, not trying to hurt you, but you get this overreactive response because the immune system is a little bit dysregulated. And I think an easy way to think of the allergy shots that Jeanette does is to just think of desensitizing. Is a nice layman's term.
And I think that's what a lot of people are actually looking for. Because if you have severe allergies, again, it's a quality of life where you're just, I mean, you think nothing can get worse than that at that point, right? Because the runny eyes and the itchy nose and going back to that allergic rhinitis a little bit, is there ever a point where people should be like, yep, I have to go to the doctor that's maybe not quality of life oriented, that maybe it can so what I'm hearing and what I kind of like about what we've talked about over the past few episodes is a lot of these aren't super serious outside of like the sleep apnea, something like that.
Correct.
That you guys you're really in the game of making people's lives livable again.
Absolutely.
Right?
Yes.
Yeah.
And that's probably the whole key.
Yeah.
So how severe do allergies have to be before you recommend allergy shots?
So typically what I do for my patients is I get a good history. So making sure that the history correlates with them actually having an allergy. And then From there, I typically give them the option of testing. So either a blood allergy test, basic, what we call a Western Dakota allergy panel, where it tests for 19 different things.
Is that the one that goes on your back?
No, I'll get into that
okay.
next.
All right.
So the blood allergy test tests for about 19 different things: some trees, some weeds, grasses, cats, dogs, and some molds. I think it's a good basic start. And then if the other option is to do skin prick testing, which that allows me to expand to test for 50 different things.
Oh, wow.
Same category: trees, weed, grasses, cats, dogs, and some molds. But I also do a little bit of food testing too. But that helps me formulate what, if you decide to go on to allergy immunotherapy or allergy shots, what your allergen makeup is going to be and what your injections are going to be.
Okay. What is probably the most common allergy you find out here in Western South Dakota?
When I first started this, so I've been doing allergy for about 2 years, I really thought it was going to be pine, just because everybody sees that yellow pine like floating around, and I don't think that's the case. I honestly think it's more like ragweed, which is just a common weed pretty much throughout the entire U.S. I think I see more positive ragweed on all of my testing than I do anything else.
So what about animals? Most common animal?
Cats.
It's a cat, isn't it? It has to be.
Cats.
Why?
Cats are terrible.
Why are they so awesome and so bad at the same time?
So cat dander is very sticky. It's just very tenacious and likes to stick to everything. And
so even more so than dogs. I mean, their skin is not that. Well,
I mean,
sense.
You can still have allergies to dogs. I think their dander is a little bit easier to control, but cat dander is just, for whatever reason, sticky and like sticks to everything. And if you have a kid who's got a cat in the house and they wear a coat and take it to school, they can transfer that cat dander to another kid who might have a cat allergy, and that kid gets symptomatic from it. So.
And you know what? The cat doesn't care.
The cat doesn't care. Cat doesn't care.
Cats don't.
This has been fun. I love having all of these questions, but coming out of this stuff, learning something that I didn't know. And I think you guys are doing a fantastic job with this. Dr. Loren Jones, ear, nose, and throat doctor in Spearfish. Also Jeanette Carlson, the CNP from Spearfish too. And you guys, someone can give you a call if they're having a problem, and
For sure.
you'll get on it and help them out. You guys have the expertise and can point people in the right direction. So when the seasonal allergies pop up and the cat's sitting in your lap, just give them a call and get it over with.
There you go.
Thank you guys so much for talking with me again.
Thanks so much.
You bet.